And thanks for joining us this Monday night at 5 o'clock. We've talked with some leaders at local hospitals, and they say right now, when they look at their patient population, they're already at capacity. And now they're preparing for even more work for when the vaccine gets here to distribute that. And that could happen as early as next week, Jenny.
Yeah, and this has been a long time in the making. 9 months ago today, the first COVID-19 case was confirmed here in Indiana. Since then, there have been more than 387,000 cases, and nearly 6,000 Hoosiers have died from the virus. Now, even though a vaccine will be in Indiana soon, many hospitals are already inundated with coronavirus patients, and they're reaching capacity.
And leaders at those facilities are telling our Rich Van Wyk that perhaps things could get worse before it gets better.
Hospitals are locked in an unrelenting struggle with a virus that is now killing more people than at any other time in the pandemic.
It is fundamentally different now than it was in the spring.
Far
worse. Far, far worse.
Steve Long is the president and CEO of Hancock Health.
It's just constant. There is no let off, and there's no release of pressure. And that will not come until the pandemic is over.
Pandemic fatigue, a feeling that masks and social distancing may not be as essential as they once were to slowing the pandemic. That may be a reason for the crisis getting worse.
I think that we mistake hope for reality. But the hope is real. The vaccine is coming, and it will get better, but it's going to take time.
Meanwhile, the number of deaths across the state has increased by 6 times since July. In Indiana, the daily number of new cases skyrocketed in November and is showing no sign of letting up in December. The Greenfield Hospital is now at or near capacity. A standby COVID unit opened over the weekend.
We have a little bit of flexibility left, but we're reaching the end.
Reaching the end as in?
As in, we will be at capacity and not be able to fit anybody else in.
Vaccines are on the way. Frontline healthcare workers may receive the first doses next week, but it will likely be months before they're available to the general public. Until then, many healthcare providers fear the crisis will get even worse.